Good morning friends, welcome to this session. Today I am going to speak on CBT, Cognitive Behavioral Therapy, and some of the techniques. Myself Pramila Singh, Professor of Psychology, Pandit Ravi Shankar Shukla University. As you know, CBT has become increasingly popular with clinicians over recent years. Surveys of therapists indicate that CBT is fast becoming the majority orientation of practicing psychologists. It is a system of psychotherapy with a powerful theoretical base which has received extensive empirical support and a large body of research attesting of its efficacy for a wide range of psychiatric and medical problems. Now, cognitive behavioral therapy is highly structured, time focused and practical approach to overcoming a wide range of psychological, emotional and behavioral problems. It involves understanding and working on the links between cognitions, thinking patterns and processes. Our behaviors, the things we do and avoid doing them, and our emotions, feelings such as anxiety, anger, depression and physiological reactions including tensions, dizziness or pain. It has been found to be the most effective approach. CBT is a most effective approach for a wide range of problems including anxiety, depression, eating disorders, insomnia, OCD, panic attacks, phobias and relationship problems, social anxiety, trauma and low self-esteem even. But how does it work? It works by identifying and altering the links between negative thinking patterns, unhelpful behaviors, distressing emotions and physiological symptoms. And this involves focusing on two main areas. And these two main areas are cognitive approaches and behavioral approaches. Cognitive approaches means learning how to identify, change or let go of negative or unhelpful thinking patterns. And behavioral approach is learning how to change or improve unhelpful and ingrained patterns of behavior and avoidance. The basic premises behind CBT is that we can change and overcome a wide range of problems by changing how do we think and what we do. This has been rigorously tested in numerous research trials and CBT is widely acknowledged as a recommended treatment of choice for anxiety and mood disorders. The causal relationship between thoughts, behaviors, emotions and physiological reactions can be illustrated using the following CBT model. This simple model demonstrates how thoughts and behaviors are hardwired to emotional and physiological feelings. The key learning point from this model is that while our thoughts, behaviors, feelings and sensations are all interconnected, negative or self-defeating cycles can be interrupted and changed by altering our thinking and behavioral patterns. Through the course of the CBT process, one gain an insight into the causes and maintenance factors for their problems. They learn new techniques to change the way they think, act and feel and will develop an increased level of personal resilience to manage difficult and challenging situations as they arise. Now, what does undertaking CBT involve? Undertaking CBT usually involves completing an initial assessment, producing a clear therapy plan and attending weekly sessions where one learns new techniques to tackle the problems. Behavioral psychotherapist helps to set specific goals, develop a clear understanding of the problem, produce a structured therapy plan, teaches how to use CBT techniques and monitor progress on a weekly basis. in addition to attending therapy sessions, the client will be asked to undertake CBT assignments between appointments. These assignments can involve learning about CBT approaches, thought monitoring, change exercises, planned exposure to difficult or challenging tasks, simple experiments to test out how you think and act in certain situations, and exercises to improve emotional well-being and resilience. Cognitive behavioral therapy refers to a class of interventions that share the basic premises that mental disorders and psychological distresses are maintained by cognitive factors. The core premise of this treatment approach has pioneered by Beck and Ellis. They hold that maladaptive cognitions contribute to the maintenance of emotional distress and behavioral problems. According to the Beck's model, these maladaptive cognitions include general beliefs or schemas about specific and automatic thoughts in particular situations. The basic model poses that therapeutic strategies to change these maladaptive cognitions leads to changes in emotional distress and problematic behaviors. The overall goal of treatment is symptom reduction, improvement in functioning and remission of the disorder. In order to achieve this goal, the patient becomes an active participant in a collaborative problem solving process to test and change the validity of maladaptive cognitions and to modify maladaptive behavior patterns. Thus, modern CBT refers to a family of interventions that combine a focused technique. Although these strategies greatly emphasizes cognitive factors, physiological, emotional and behavioral components are also recognized for the role that they play in the maintenance of the disorder. Research over the last 40 years or so has found that CBT is to be helpful for all manner of problems, including anxiety, depression, insomnia, pain, anger, sexual problems, and the list goes on. CBT is probably best understood by what it is trying to achieve. And the main premises of CBT is that problems develop as a consequence of learned ways of thinking, that is cognition and behaving. And that learning new ways of thinking and behaving will have more helpful impacts on emotions and well-being of the client. Cognitions, that means the cognitive element of CBT, it refers to our thoughts, mental images, self-talk and core beliefs about ourselves, that is I am okay or I am not okay. Other people, they are generally friends or family members and they are not, and the world around us, that is the future is bright or it is not. So, this type of cognitions, the more threatening our thoughts, that is I am going to be criticized, the more anxious we will feel, the more helpless or hopeless we believe the future is, there is no point in living. The more depressed we will feel, the more strongly we believe things should be different, the more frustrated and angry we will feel. The way we think is guided by what we pay attention to, that is a tendency to focus on negative things. The way we interpret what is happening around us, that is seeing the glass half or full, and the experiences we are most likely to remember, such as the times things went bad rather than the times things went well. We all use particular styles of thinking from time to time that can get us into trouble. We are catastrophizing when we blow things way out of proportion. Using words like never and always is a good sign we are thinking in an overgeneralized way. Most bad things happen somewhere between never and always. Now, behavior. The behavioral aspect of CBT is based on learning theory. Classical conditioning. Emotional responses can be classically conditioned. As a simple example, say someone with a dog phobia might call being bitten as a child perhaps be one of Pavlov's dogs. Cognitive behavior therapists help clients better understand why they might have developed particular problems and, more importantly, what vicious cycles are maintaining them. A strong therapeutic relationship is very important in CBT. Cognitive behavioral therapists appreciate that therapy can be emotional and difficult. They know their client needs to trust them before they will be able to work effectively together. Empathy, genuineness, unconditional positive regard and warmth need to be there. CBT also involves a close working relationship between the client and the therapist. The client is seen as an expert in their lives and the therapist is seen as an expert in evidence supported treatments. Both forms of expertise are equally important to achieve a good outcome. CBT also aims at to be an efficient and time limited form of therapy. Goal setting is very important. A cognitive behavioral therapist will be very interested in what you would like to achieve from therapy. And generally in the process, they have to plan how to get there and how long it should take. Monitoring and evaluation is again important. Cognitive behavioral therapists don't rely on their own judgment, but when client's problem have resolved, the therapist might be wrong, rather they measure change from the client's perspective. The therapist might ask the client to complete some monitoring or questionnaires during therapy so that progress can be tracked. Cognitive behavioral therapists don't blame the client if the problem isn't improving. The therapists take responsibility for changing what is done in the therapy to ensure that things get back on track. Practical skills are also important, and CBT aims to teach clients to relate differently to their thoughts. Physical sensations, emotions and behaviors so that they don't get caught up in them in problematic ways. One technique might involve identifying negative thoughts and challenging them by recognizing when they are overly catastrophic and generating more realistic and helpful alternatives. The techniques covered in CBT will depend on the nature of the problem. That is important. But cognitive behavior therapist encourages clients to apply their new skills between sessions and report back on how it went. This is where much of the hard work, learning and changes occur in CBT. CBT also acknowledges the role that past experiences play in shaping into what we are, who we are, but at the same time recognizes that little can be done to change what has already occurred. Instead, CBT focuses on identifying what is left behind from these experiences in the form of core beliefs about ourselves. and others and the world, and how these beliefs impact on present day experiences. And modifying this core belief can change our emotional responses to memories of earlier negative experiences and can change the way we respond to changes in our lives now and into the future. A cognitive behavioral therapist's role is to guide, support, and cheerlead when required. CBT's aim is to increase clients' coping self-efficacy, their confidence in their own ability to manage their problems on their own. If a cognitive behavioral therapist has done a good job, the client should leave therapy knowing that they are responsible for the benefits they have achieved from therapy and that they can continue to build on these gains well into the future. There are a number of specific types of therapeutic approaches that involve CBT that are regularly used by mental health professionals, and some of the example I can mention here. As you know, rational emotive behavior therapy proposed by Ellis, we call it REBT. This type of CBT is centered on identifying and altering irrational beliefs. The process of REBT involves identifying the underlying irrational beliefs, actively challenging these beliefs, and finally learning to recognize and change these thought patterns. This form of therapy is centered on identifying and changing inaccurate or distorted thinking patterns, emotional responses, and behaviors. Cognitive therapy, as we know, this form of therapy is centered on identifying and changing inaccurate or distorted thinking patterns, emotional responses, and behaviors. Multimodal therapy, this form of CBT suggests that psychological issues must be treated by addressing 7 different but interconnected modalities, which are behavior, affect, sensation, imagery, cognition, interpersonal factors, and biological considerations. Then we have dialectical behavior therapy, and this type of cognitive behavioral therapy addresses thinking patterns and behaviors and incorporates strategies such as emotional regulation and mindfulness. In cognitive behavior therapy, psychological problems are believed to develop through the use of cognitive distortions. Aaron Back's work suggests that by correcting these distortions, a more accurate experience of events can be created. Through this work, a patient is better able to develop skills to properly process exposure to life events. Now, what are the cognitive distortions and how important they are to understand? Through the examination of their cognitive distortions, an impact on reducing that stigmas might be made. Developing a deeper understanding of what these distortions are and creating a way to reframe thoughts, behaviors, and actions can help human being. Now, these distortions, now we can take one by one. One is mental filtering. Mental filtering is a cognitive distortion where we tend to filter things out of our conscious awareness. We choose, for instance, to focus on the negative events rather than on the positive outcomes of a situation. Therefore, the way we perceive and interpret reality is based on flawed negative perspective that is preventing us from seeing things clearly. Then jumping to conclusions. Jumping to conclusion is a cognitive distortion where we tend to make irrational assumptions about people and circumstances. We, for instance, assume that something will happen in the future. That is, we call it predictive thinking. or assume that we know what someone else is thinking, mind reading like. So, another thinking distortion is personalization. It is a cognitive distortion where we constantly take the blame for absolutely everything that goes wrong with our life. Whenever anything doesn't work out as expected, we immediately take the blame for this misfortune. Then thinking distortion occurs when we think in terms of black and white. That is, it is again a cognitive distortion where we tend to see things as all or none, all or none, nothing, all or nothing. Things are either good or bad, right or wrong. In other words, we only see the extremes of the situation. We either see one extreme or another, and there is no middle ground, nor shades of grey even. Then catastrophizing is cognitive distortion where we tend to blow circumstances out of proportion. In other words, we make things out to be a lot worse than they should be. Now, of course, the reality of our predicament might actually be very different. So, extreme thinking. Then overgeneralization is again a cognitive distortion where we tend to make broad generalizations that are based on a single event and minimal evidence. More specifically, it is the tendency to use our past experiences as a reference point for making assumptions about present or future circumstances. Then labeling is again a cognitive distortion where we tend to make a global statements about ourselves or about others based on situation specific behavior. Now, of course, how we label things often mirrors our internal belief systems. In fact, the more we tend to label something, the stronger the belief system at play. This is unhelpful because our labels are often based on past experiences and personal opinions rather than on facts of life or evidence. Then there is another cognitive distortion, that is magnification and minimization. Magnification and minimization is a cognitive distortion where we tend to magnify the positive attributes of another person, while we try to minimize our own positive attributes. That means you talk down all your positive attributes and accomplishments in order to lower people's expectations. Then emotional reasoning, where we tend to interpret our experiences of reality based upon how we are feeling in the moment. Therefore, how we feel about something effectively shapes how we perceive and interpret the situation we find ourselves in. Now, therapy techniques that has been used here, I would like to mention Alice's work. Albert Alice developed the ABC technique that is still utilized in CBT today. And this ABC technique of irrational beliefs analyzes the first 3 steps in which someone might develop an irrational belief. He called it A is activating event, B is belief, C is consequences. Activating event, this is an event that would lead someone to a type of high emotional response and or negative dysfunctional thinking. Then belief is the client would write down the negative thoughts that occur to them around the activating event. And third component, which is consequences, these are the negative feelings and behaviors that occurred as a result. The beliefs are to be viewed as a bridge to the negative feelings and behaviors that occurred as a result of the activating event. So, Alice believes that it was not the activating event that causes the negative beliefs and consequences, but rather how the patient interprets or misinterprets the meaning of the event that helps cause the consequences. Helping a patient reinterpret their irrational belief system helps to forge new ways for them to interpret their beliefs, resulting in alternative behaviors. A person can utilize this technique even in the absence of a therapist even. A recent popular technique being utilized in CBT is called acceptance and commitment therapy. It differs from traditional CBT in that it is not trying to teach people to better control their thoughts around their activating events. Instead, this approach is teaching people to just notice, accept and embrace the feelings around the activating events. This approach utilizes techniques from CBT as well as focuses on feelings the patient from the grip of the event itself. Then another technique is mindfulness technique like deep breathing and progressive muscle relaxation. They play a big role in CBT. These techniques allow the person to be present in the moment and calmly soothe the unfocused mind. With the relaxation comes the stronger ability to tune in and alter automatic negative thoughts. Cognitive restructuring is a CBT technique that helps people examine their unhelpful thinking. It helps them to redevelop ways to react in situations that have in the past proven problematic. Keeping a daily record of the automatic negative thoughts creates a way to find the patterns in these thoughts. With an identified pattern, alternative reactions and adaptive thoughts can be forged. Activity scheduling is powerful technique in CBT. This is another technique. It helps people engage in activities that they are not normally used to doing. It presents as a way to slowly reintroduce rewarding behavior that has been excluded from people's routines. The technique is very helpful in increasing positive emotion when performed incrementally. Then one more technique is there, that is graded exposure. It's a technique used to help expose anxiety sufferers to contact with what is feared. The underlying theory is that people who avoid situations that induce fear or anxiety will increase the anxiety, and the slowly increased exposure aids to decrease that fear. Many deficits in social skills can be improved through CBT techniques. Modeling, role playing and instructions can be used to increase social skills like communication and assertiveness. Communication skills, or rather the lack of, are a massive obstacle for many. Improving these skills bolsters confidence and abilities to interact with others, dramatically reducing levels of anxiety inducing situations. So, these are the techniques we can use in CBT or we are applying in clinical setup. With this, we come to end of this session. Thank you very much for watching this video. Thank you very much.